peptides are really running the show with our physiology and how our bodies work. And as technology has moved throughout the decades here, we as a scientific community have really figured out how to harness them and utilize them synthetically to kind of biohack our bodies and make it do the things that we want it to do.
Wits and Weights community, welcome to another episode of the Wits and Weights podcast. Today, I'm joined by Kristin Gemme, a board-certified physician assistant with over 10 years of experience as a PA and 16 years in the medical field. She's the owner and operator of Ethos Medical Aesthetics and Wellness in nearby Avon, Connecticut. And we connected through my coach and recent podcast guest, Andrew Romeo. I had the pleasure of being on her podcast, Just a Pinch, to talk about nutrition and wanted to bring her on my show to discuss peptides, hormone therapy, medical weight loss, and other ways to complement lifestyle interventions. Kristin has a passion for helping people achieve optimal health with personalized holistic interventions such as skincare, injectables, lasers, PDO threads, and wellness programs. And as I mentioned, she's also the host of the Just a Pinch podcast, where she discusses the good, the bad, and the ugly side of aesthetics, fitness, nutrition, and wellness. Kristin, welcome to the show.
Thank you so much for having me on. I'm excited to be here.
I'm excited as well because it's been a while since we talked, and I want to get a little bit into your backstory first and then dive into some of the specifics here that people want to know everything about.
Sure.
So what inspired you to get into this field to become a PA, but also specifically pursue a career in aesthetic medicine?
So my road to becoming a PA was a little bit complex, but I don't think outside the norm. I was in my undergraduate education over at Endicott College in Beverly, Massachusetts, and I was in the nursing program. And while I was going through some of my clinical rotations, I found myself being very much so drawn to what the doctors and the PAs and the NPs were doing and drifting away from my nursing care plans and IV drip titration. So I had, a real kind of come to Jesus moment with myself and my advisors and said, you know what, I think I want a little bit more. I think I want more of the science. I want to be the one making the decisions and making the calls as opposed to implementing the plan the way that nursing typically goes. Mm-hmm. So I jumped ship. I switched my major in the middle of my education into biotechnology with a biology concentration and pre-med. So I wasn't sure at that point if I was going to go through medical school or what I was going to do. But I had some friends and family members that were going through the medical education and really recommended that I investigate physician assistant as a career versus an MD. And I am so happy that I did. And from there, I went to Springfield College and did their graduate master's program to become a PA. And it was during that time that I really found a love for aesthetic medicine and skin. But I wanted to do a little bit more than just classic dermatology. I love skin. I love the science of it, but I like to do stuff. I'm a do stuff kind of girl, and I like to do procedures. I like to use my hands as well as my brain. So I found the aesthetic side of dermatology and skincare to really be where I would thrive. So all day I am using my hands. I'm creating these treatment plans in my head and using the science and then implementing them with my hands, whether it's utilizing laser technology, doing a lot of injectables, placing IVs, all sorts of different things. So it was just kind of the perfect blend for me.
Okay. And that I like that combination of doing and coming up with the plan, but also using your hands and brain. Aesthetic medicine, tell us just a little bit more about that, because we don't get into that on this show, as you would imagine, as much, because I want to be able to tie it in a relevant way to, the listeners thinking, where does this fit into an overall nutrition or fitness plan?
Absolutely. And so, a lot of that comes from my personal background. So I did not enter the PA space directly into aesthetic medicine. I always knew it was something that I wanted to do, but it's not where I started because I know that I needed a good base. I needed a really strong medical base. And I love medicine. I love all of it. So I worked for several years in primary care, treating ages 5 to 100 plus. And from there, I worked in the surgical trauma critical care unit in Hartford and took care of critically ill patients, going through some of the worst days of their life and their families' lives. I did some part-time and full-time work in urgent care. So I've kind of seen it and done a lot. I've had a lot of exposure to medicine and especially to primary care because I like the concept of being able to take care of somebody across the lifespan, but I was really, really disenfranchised, truly being directed by insurance companies. And I mean, that's a huge conversation to get into with just the current state of medicine in America. But it made it really difficult to take care of people the way that I wanted to take care of them and to be able to give them the time that they deserved and to investigate and utilize tools that aren't readily available in the primary care world. So from there, I was able to transition into aesthetic medicine where I got to do the stuff. I got to learn the skincare even more. I studied under a facial plastic surgeon in Massachusetts and was able to see things from the inside out, assisting in facial plastic surgery, which I think was really imperative in my knowledge today of skin and anatomy. And what aesthetic medicine ultimately is we're utilizing medicine, technology, biotechnology for elective interventions. Now, a lot of what we do is truly taking care of the skin, but it's nothing that insurance companies are going to be covering. So this is all out-of-pocket cost for the patient trying to improve the health of their skin. You know, you can go, I mean, the gamut of aesthetic medicine goes everywhere from purely aesthetic, you know, reduce my wrinkles, I want a brow lift, I want bigger lips, I want all of these things to make me feel and look more beautiful, all the way to treating burn scars, acne scars, surgical scars, helping erase trauma from people's skin and helping them on different levels. So there's a real wide range of aesthetic medicine. So aesthetic dermatology, aesthetic medicine, there's a bunch of different terms out there for it. But I do everything from, you know, plumping the lips of 25-year-olds to helping erase domestic violence scars off the bodies of women and everywhere in between. And when I opened up Ethos, not only was aesthetic medicine important to me, but wellness was too. That's where I kind of circled back to my primary care days and even my critical care days. And I really wanted to integrate total body optimization. And that's kind of my tagline for Ethos is total body optimization. Because it's not just how we look on the outside. It's truly, we need to be healthy on the inside and feel good. Yeah. And that's kind of how I define wellness too, is you're not just not feeling bad, you're feeling good. And that is what we're looking for with wellness.
I love your answer. I think a lot of people can relate to, you called it disenfranchisement, disillusionment, whatever, of the GP and primary care industry, as well as the lack of options or even the gaslighting, whatever phrase you want to use when it comes to hormone issues, women's health. I mean, I've seen it all with my clients, with my wife, you know, with so many people. Yeah. And the idea of pursuing wellness for its own sake for you, whatever that comes in, whatever form, is a positive thing. Like, it doesn't matter if it's, everybody has different reasons, right? And there may be a physique or physical reason. There may be an underlying tie-in between something that happened to you, like you said, the domestic violence scar and trauma, or how it makes you feel, all that. So I'm fully on board with that. And the total body optimization approach is really cool. So why don't we get into some specifics? Because there's areas here that I may have talked about on the show once or twice, but you can really shine a light on it. The first one is peptides, right? Yes. What are they? I know they're proteins. I talked to remember Dr. Rand McClain a long time ago on the show about it. Yes. What are they? How do they work in the human body? Just so we can start the conversation there.
So, I mean, we're made of peptides. We function with peptides. Peptides are nothing more than short chains of amino acids, which are the building blocks of proteins. And these peptides are doing, I mean, countless different functions in our body. It's also part of a lot of medications, such as like insulin. Insulin was really, truly, I believe it was the first peptide-based medication available. So peptides are oftentimes signaling. They're mimicking something. They're turning something on. They're turning something off. They're going to work in our body and either mimicking a hormone or a neurotransmitter, or they're just helping your body function better. There's certain peptides that get released by your body naturally to say, hey, release more insulin, release more glucose, release more of this neurotransmitter, release more of this serotonin. All of these things are signals. So peptides are really running the show with our physiology and how our bodies work. And as technology has moved throughout the decades here, we as a scientific community have really figured out how to harness them and utilize them synthetically to kind of biohack our bodies and make it do the things that we want it to do. And peptides, for the most part, are extraordinarily safe as well. There's a lot of research behind them. They've been being used for decades across the world, and there's a wide range of them. Now, within peptide therapy, for what I do, we're really focusing on the growth hormone releasing peptides or stimulating peptides. So these are products such as sermorelin, ipamorelin, CJC1295. Those are some of the more common ones, but there's a whole bunch of them out there. And what these are doing is you're injecting them into your body about 3 to 5 nights a week for cycles of anywhere between 3 to 6 months. And what you're doing is right before bed, you're injecting it so that your own natural growth hormone that's getting released by your brain at night when you hit that deep sleep cycle is boosting up more. So growth hormone really peaks when you're about 20 years old. And after that time, all it's going to do is your natural production is just going to slowly go down. Like with everything in our body, we just stop producing as much. So we want to give it a little boost. So what's the alternative to it? HGH. Everybody's pretty familiar with that term.
Yep.
And is it an option that I offer because it's a little bit more dangerous? There's a lot more side effects that come with it. You're supplying an exogenous outside hormone. So when you do that, your body is going to stop making your own. So it becomes a lot more of a chronic thing that you need to stay on. Whereas peptides, all we're saying is, hey, make a little bit more, but it's staying within your body's own natural feedback mechanism. So it's almost impossible. I never say impossible with anything with the body, but it is almost impossible to overshoot your target and to start cranking out so much growth hormone that now your heart's enlarging, your organs are enlarging, and we're creating, situations that could even give you diabetes. Those are things that we see more so with HGH that we don't see with peptides. So peptides are a safer alternative to helping boost your own natural HGH while staying within your body's own safety parameters.
Okay, so I want to explore that a little bit specifically. I want to understand which populations this is for, because it sounds like there's an aging component to it because of the loss of your natural production. But also, I'm a big fan of understanding like the before after, like what kind of data, what kind of tests do we get to actually see that it worked and it's not, some magical elixir that, because people are going to be skeptical of this stuff, especially if it's newer on the market. How do they know that it actually made a difference other than how they feel? So let's talk about that. Yeah.
So for me, the way that I practice medicine and utilizing peptides is safety always first. We always start out by doing some blood work. And blood work, we can either have you go to a lab, or my preference is I draw it right from you right in my office, in my chair during our consultation. So when we look at your blood work, we're really trying to look at a snapshot of your overall health. So we're looking at your metabolic health. We're looking at your thyroid function. We're looking at your hormones, especially with men. Blood work tends to work best for hormones. So looking at testosterone, free and total, sex hormone binding globulin, estrogen, ultra-sensitive estrogen at that. We're looking at C-peptide. We're looking at a fasting insulin level, your hemoglobin A1C, which is kind of your average blood sugar over the course of 3 months. I'm going to look at how your kidneys, liver, electrolytes, a complete blood count, all of it. We may even dive deeper into some other things too. And one of the most important markers that I like to look at when looking at peptide therapy is an IGF-1 level, which is an insulin-like growth factor level. This is ultimately what we're trying to target when it comes to growth hormone and with these peptides. So we want it within a certain range. We like to see high normal. We can even see outside of high normal, but only for short periods of time. If we were to have that level be too high too long, that's when we can look at some studies that show that it can affect cardiovascular health or your glucose metabolism and things like that. But that's why we have all of these safety parameters set already with how we do peptides. There's really safe protocols. And if you follow the protocols and you're monitoring these things, they're extraordinarily safe. So we always start out with that. blood work, when I draw it in my office, I get results back typically within 48 hours, which is faster than any lab that you're going to see around here. If you go to Quest, we're waiting 2 weeks before we get results back. So love to see you in my office for this. So once we have your baseline health, we look at everything. We say, all right, are you a candidate for peptide therapy? What does your IGF-1 level look like? Most adults that are over the age of 40, I'm seeing their IGF-1 levels pretty low, either remarkably low or low normal. And these are people that are going to benefit, honestly, the most for peptide therapy because they are deficient and we know that they're not producing enough of their own natural growth hormone. Now, even people that are completely normal within their IGF-1 levels or even high normal, you're still a candidate. As long as you're not off the charts high at baseline, all of your organ functioning is good. You have no major chronic medical problems, like big things that are affecting your organ function, we can go ahead and get started. And with that, I always start slow and low. So we're going to start you off at an introductory dose. We're going to see how you feel, see how things are going for you, see if you're having any side effects or not. And if you're doing good, each month we're going to bump you up a little bit until you're going to really feel that difference. And so far, the results have truly been amazing. And by results, I mean subjective and objective. So subjectively, people feel great. You feel better and better every week. With peptides, typically week 1 and 2, you're just going to be sleeping better. It can tend to make you a little bit sleepy, which is awesome because that's what we want. You're injecting it right before bed. So you're going to be sleeping deeper than you ever have. If you have any of the wearable biometrics, like I have an Aura ring that I like to wear, this showed me after 2 doses that I was getting much, much deeper sleep and for longer periods of time. So my restorative sleep was better than it was by itself with just my own body here. And for reference, I am 36 years old. So much, much better with just that. As the weeks go on, I start noticing at the gym, it almost feels like when you first start taking creatine, where you feel like, oh, I've got a little bit more in the tank than I used to. I can tap into that extra gear that I couldn't really get to last time. And I'm recovering better. I'm not as sore as I was. All of those things that make your gym going experience get better. As time goes on, aches and pains start to go down, kind of that chronic, I have that tendinitis that I just can't get rid of. All of a sudden you wake up one day and you realize that it's gone, it's fixed, it's better. And then from there, your energy levels get better. Your energy levels get better also because you're sleeping better. You're more restorative. We all know top to bottom that sleep is the most important thing that you can focus on when it comes to your own wellness and well-being, and being able to get over illnesses, injuries, and get those gains in the gym too. You have to sleep. Sleep is more important almost than your training session itself. From there, it's going to help improve your metabolic health. Everybody that I do repeat blood work on, which if you're on peptides, we're going to do repeat blood work at the end of your first 3-month cycle. And it's amazing. People that didn't have metabolic issues, their cholesterol was normal, their blood sugars were normal, nothing that any doctor would ever look at and say there was a problem with, still improved. People's A1Cs that were normal are even better normal. Cholesterol was good. It's amazing now. So we're seeing real improvements in metabolic health. And as we're seeing those improvements in metabolic health, we're seeing changes in body composition as well. Body composition with peptides does take a little bit longer to happen. That magic really happens between months 3 and 6. Just a longer exposure to the medication, and you're going to support lean muscle growth. So it's going to be easier for you to put on lean muscle. You're not going to bulk, especially for women. Like, you are not going to just get swole off this stuff and feel like you're getting bulky and big. It's not HGH. And I can't repeat that enough. It is not HGH.
And the women listening to this podcast by now should know that muscle is the best thing in the world. So hopefully it's good.
Exactly. So, and we also know here, the more muscle that you have, the more fat you burn, because we are increasing your basal metabolic rate. So we see weight loss, we see fat reduction because of all of these health metrics. It's not a magic pill for weight loss. It's not something that you take and all of a sudden you shed all this body fat. It's a long-term it's a long-term thing, and it's fixing you from the inside out. Now, the reason that we take you off of it at 6 months is ultimately not because it's dangerous to stay on, but because we want you to be able to utilize it long-term in cycles. And if you were to continue to use this without breaks, there's a chance that your body just gets used to it and you're not going to get those benefits from it anymore. So we give your body a break. Everything goes back to normal. There's no withdrawal. I just came off of a 6-month cycle myself. I am about a week off of it. I feel no different. There's no withdrawal whatsoever.
Yeah, I'm on board. So that sounds like, a lot of the benefits people hope to get from testosterone or anabolics or other things. And it sounds a little bit safer than that. How do you separate that from natural interventions? So for example, IGF-1, we've talked about here, can also be increased by increasing your protein, which a lot of people are deficient. Also by strength training itself. How do you divorce the two? Because, we want to understand that is giving you the impact independent of those factors. Do you start somebody on lifestyle changes? Where does it come into play?
So, I always promote lifestyle changes. If we're doing an intervention like peptide therapy that you are committing to and you're investing in, sure, you can sit on the couch and change nothing about anything that you're doing and decide to not work out and not eat right and not do the things. And you're still going to get some benefits because you're still going to boost your own natural growth hormone. But it's a waste, in my opinion. So anytime that we're starting these things, we're also discussing the need to do some weight training, to exercise, to dial in your nutrition, to make sure that your lifestyle is including good sleep. I don't want you, injecting yourself at 3 a.m. with this stuff when you're getting into bed to get up at 6:30 for the day. We're kind of defeating the purpose of it. Now, how do we differentiate between what's coming from the peptide versus what's coming from the other parts of your lifestyle? You cannot. You cannot unless you were to do a controlled study where you are doing nothing other than utilizing your peptide and not doing the other things. And ideally, I don't want you to do that. So it's all a cumulative effect. And one thing I didn't mention with peptides too, especially with men, if men are a little bit on the low side of their testosterone, because like I said, I like to look at that when we're looking at peptide therapy too. If you're a little bit low, we don't necessarily need to reach for testosterone right away either. I do typically see testosterone levels boost, mildly. It's not going to shoot up into a huge range. It's not testosterone replacement. But because we are dialing in your body and your metabolic system here, I do see nice modest boost in your testosterone level as well with peptide therapy.
And you mentioned the increase in lean mass and the improvement in body composition, which we know comes from both adding muscle and losing fat, usually through diet. Is this because of the additional performance you can gain in the gym, or is it somehow directly making it easier to synthesize muscle, right? What's the mechanism there?
All of the above. All of the above. So if you look at things like HGH and growth hormone, those are the benefits that you're getting from peptides. You're just getting it in a smaller pulse. So everything that you are doing is augmented. Think of every rep that you're doing, every squat, every curl, everything that you're doing is augmented and almost on steroids, right? So you're getting more out of each of those things.
Yeah, I'm going to have to come in and experiment with this and talk about it on the podcast in my next cycle of my building phase. Let's talk, because I'm curious about that, to see the differences and get some blood work and whatever.
Absolutely.
How do you see this evolving over the coming years and decades? Because peptides, I know you said certain peptides like insulin have been around for a while, but I've heard the term used more often in terms of these specific types. Yeah, tell me more about how the field is evolving.
So there's a lot up in the air, honestly, with how it's going to evolve. Very recently, if you were to do a Google search right now on peptides, specifically ipamorelin, CJC1295, ibutamorin, any of these, you're going to see a big pop-up all over Google saying, FDA, shut it down, and these are illegal, and we can't use them now. Yes and no. Peptides, the ones that I'm talking about, have never been FDA approved. That's in all of my consent forms. That is what we talk about with patients. These are not FDA approved medications. They are not FDA approved mainly because they are not as efficacious as HGH. And for something to get FDA approval, it has to prove its place. It doesn't matter that it's safer. It doesn't matter that it's doing very similar things in a safer manner. the end results of studies obviously are not going to be as potent as HGH. So that is one of the main reasons why they're not FDA approved. Now, the memo that went out several weeks ago regarding taking these peptides off the market, it's not that they're illegal. It's not that you cannot use them. What they did was they made it so that compounding pharmacies, which is where we get them from, can no longer obtain the raw materials to synthesize them. And now what I'm about to say is going to be nothing more than my opinion. Nobody truly knows the nitty gritty, backdoor deals going on here. But I've spoken to many providers that do similar things that I do here with peptide therapy. And we're all pretty much in agreement that the wrong people were making money off of peptides. And the powerful people were not. So there are, because they're not FDA approved, big pharma companies are not able to synthesize them. They are not able to put their price tag on them and a brand name and put them on the market. So they're not getting paid off of it. And unfortunately, a lot of those companies also have their hands in the FDA. A lot of high ups in the FDA are old executives of these pharmaceutical companies. So there's a lot of conspiracy opinions about all of this. The memo that I read from the FDA that went out to the compounding pharmacies, it just shook my head. They're saying, oh, we saw safety issues with this medication when it was administered intravenously. Well, it's a good thing that we don't administer them intravenously. I mean, if you grind up carrots into a puree and inject it intravenously, you will die. Does that mean that carrots are unsafe and should be taken off the market? No. So there's a lot of drama around it. But in all of our opinion, for the providers that have been using these for years and have seen incredible changes in their patients' health coming off of chronic medications, sometimes being able to come off of, lifelong medications to treat metabolic conditions, or even anxiety medication, depression, mental health, all of these things. People are taking less pills because of peptides. And, to not sound like a conspiracy theorist, I think that has something to do with all of a sudden the shutdown of those specific peptides. Now, there's just a couple of them on there. So not everything is on there, and we can still get them completely fine from all of the pharmacies that we've been getting them from. Ipamorelin, which is my personal favorite, it has a very low side effect profile. It's very safe. It's easy to dose. It's very reliable. That one, I'm no longer going to be able to get. Believe me, when I got that memo, I stockpiled it. So I have a hefty pile of it in my stock here. For all of my patients that are currently on it, they need to be able to continue their cycles. But Sermorelin was not taken off the market, which is crazy. It does the exact same thing as Ipamorelin. The exact same thing. So that's just the one that I'm going to be transitioning patients onto. So there's a ton of research about a lot of different peptides out there right now. And some of the biggest players in the world of peptides in medicine, some of the physicians out there, I mean, they're using peptides that we've never even heard of. So the technology is there, the advancements are there. So I think over the next decade, we're going to see kind of a whittling down of peptides into ones that are, really tried and true, are safe, have a lot of data behind them, and that we can trust, because that's the main thing, especially when we're working off label, or non-FDA approved procedures or products, is you as the provider really need to feel confident with what you're offering patients, what you're doing.
Yeah, a lot of what you said makes a lot of sense when you look at the healthcare industry as a whole, and how, the sick care versus healthcare paradigm, the money is definitely made from keeping people in a certain state where they're going to buy meds. I mean, we know it. I don't even call it conspiracy. It's just truth. Yeah. You see it out there.
Yeah, we're a sick culture. We're not a well culture. Nobody makes money when people are healthy.
Yeah, and I think the same thing for hormones, because this is a good segue. Hormone treatment. I've seen it with so many women in my life that it is like pulling teeth to get I pretty much say don't talk to your primary care, like your PCP anymore, about hormones because they're not going to help you. Like I just seen that 90% of the time. There could be a few good ones out there,
Yeah.
but both access to treatment, the types of testing, oftentimes the testing that's performed is inadequate because it's, maybe it's not the free version of the hormone. Maybe they need, I don't know, saliva or metabolite testing, all this.
Absolutely.
So let's get into hormones.
Yeah. Hormone.
Lay it on me, the testing side, who benefits, what kind of therapy, men and women, all of that.
So there's a wildly diverse range of hormone therapy out there. And most of it is being done now by these wellness centers. You basically, in order to truly take care of somebody's hormonal health, not just testosterone, not just estrogen, I mean, just about any hormone in your body, you can't involve insurance companies. Insurance companies have these really bananas standards and like just numbers that say, if you are this number, we will cover this medication. If you are this number, we will not. And they're not treating the patient. Insurance companies don't allow you to treat the patient. They're just treating a number. And they're not covering a lot of the testing, and the testing is done incorrectly. For men, yep, we can pull blood. We can see some really good results easily with blood. With women, blood work for hormones, depending on what we're looking at, is relatively useless. It will tell you if there is a massive problem with a hormone, but it's not going to give us the information that we need to know to be able to determine really your hormonal replacement levels. And saliva testing, dried saliva, is truly the best for that. And as we know, women's hormones are wildly complex and are so different than men. Men are simple. My men treatment.
We're simple in many ways.
1 + 1 = 2. Here we go. Here's our algorithm. This is great. Easy to treat.
Sure.
You give me a female and it's like, let's put on our thinking caps. Let's stare at this for a while. Do a ton of physical history. We need to know exactly where you're at in your menstrual cycle, what day you're on. If you are perimenopausal and irregular, or you are postmenopausal, yay, now we get to figure that out too. So it just makes it a lot more difficult, but it can absolutely be done. Now, there is a lot of weird, distorted old studies when it comes to hormone replacement as well, specifically the sex hormones, so estrogen, progesterone, testosterone. And if you look at some old studies, they were saying, oh my gosh, this gives you testicular cancer. This gives you all sorts of different types of cancer. It's going to give you blood clots. It's going to make you have a heart attack and die. And unfortunately, a lot of physicians and providers in the space, whether it be primary care or urology, OBGYN, they read those studies and then just said, okay, we're not doing hormones. We're going to wipe our feet of that. We're not touching them because it's not worth it. And it really comes down to those studies were flawed design. Testosterone will not give you testicular cancer. If you have testicular cancer, testosterone replacement can potentially expedite it. It can make it advance faster. However, recently, there was another study that just came out that showed that now some forms of testicular cancer are actually being treated with testosterone.
Interesting.
So there is a lot of combative data out there. And when it comes to cardiovascular risk with testosterone therapy, the thought was always, it's bad. It's going to give you a heart attack. It's not good for your heart. It's actually very false. If you are causing so much more damage to your cardiovascular system being deficient in testosterone than being on it. So you are actually boosting your cardiovascular health when you are on replacement. Now, from a medical legal standpoint, this is where it gets really kind of into uncomfortable territories for some providers and people. And it really depends on your provider's comfort level. Some people will say, listen, I don't care if you've had a cardiovascular event. You're really low, and I think that you're going to benefit from going on therapy. Absolutely. And they're going to go on it. Other providers are going to say, oh, you have a personal history of a heart attack 10 years ago. I'm not taking that risk. And it's somebody else's problem.
The same reason, right? Yeah.
So it's tough, and it's really personal preference on that. Now, when it comes to female hormones and those studies, Those ones are also a little bit complex too. A lot of the poor data that was coming out of those were based on synthetic hormones.
Synthetic
And
progesterone, especially,
yes,
right?
exactly.
Yeah.
Coming from like the pregnant mare urine, the PMU foals, all of that. So coming from synthetically made hormones. That data is not supported by bioidentical hormones.
Right.
Bioidentical are exactly what they sound like. Bioidentical. They are molecularly identical to the ones that your body makes on their own. So those kind of,
Real quick, let me stop you. So the synthetic progesterone,
yes,
is that also in the pill, or at least one variant of the pill?
yes,
And doctors have no problem prescribing that
no
to
problem.
women of all ages for whatever
Yep,
reason instantly. Okay.
yep.
Continue.
Welcome to America.
Yep. No, I've heard it. Yep. No, I can empathize. Again, so many women I
Yep.
know have gone through this. Okay,
Absolutely,
continue.
absolutely. So now when it comes to replacing hormones, there are a ton of different ways to do so. And your local compounding pharmacy that is of high quality standards is going to be your best friend. Because going to your local CVS to pick up your prescription is likely going to be not covered by insurance and take your head off. When we go through
Mm.
compounding pharmacies to get either an injectable form of testosterone, which is my personal preference, or you can get compounded creams or lozenges or pills. I mean, there are, you name it. If you need a way to get a hormone or substance into your body, your compounding pharmacy is going to be the one to do it and to do it well. Now, with that being said, not all compounding pharmacies are built the same. You really need to be careful about who you're going through, making sure that they are third-party tested and vetted and have a very good reputation for standards of quality.
Mhm.
I have a handful of them that I use, and I trust them, and they're wonderful, and they are affordable, which is the main important part here.
Sure.
So with testosterone, I really like it injectable form. Testosterone cypionate is one of my favorites. There are different ways that you can play with it. You can use different testosterone blends, so that way they have different half-lives. So you're missing big peaks and valleys if somebody's really sensitive to that. But testosterone
Mm.
cypionate is my favorite go-to to get men on it and to get it just started. And then we go from there. Start simple. I like to keep things as simple as possible for people.
Yeah, the minimum effective dose.
Yes.
Let's talk about testosterone for a second. When we're testing men, because I've heard so many different, so much different guidance on the ranges of values. Right, we have the population range that doctors
Yeah.
use. Then we have the symptom centered
Yes.
kind of approach of like it almost doesn't matter if you have symptoms.
Mhm.
And then we have kind of different ranges in between.
Yep.
What's your guidance?
So my personal philosophy on it is a blend. So you need to, by law, you have to have a symptom in order to go on testosterone. You have to have a documented symptom. The crazy thing is that it can be as simple as I have chronic fatigue. I am tired all the time. I don't feel like
Mhm.
myself. I feel depressed. I'm not sleeping well. I am not getting morning erections anymore. I'm having difficulty with sexual activity. I have decreased desire. You know, my wife hates me right now because I'm not acting like myself. I just feel like a lump on a log. This is kind of the chronic condition that we see with men with low T, at least on some level. So you need to have at least one symptom. From there, you don't need to be real low, but you need to be suboptimal. If you have a testosterone level naturally when we pull it of 900, you're flying high. You are a high T king here, as I like to call them, and you're just like, yeah, I'm just tired. I'm a little depressed. I'm not. We're not
Yeah.
going that route. I
Right.
don't think it's the most appropriate because for the most part, once we start testosterone, you're on it. We're replacing it. We are replacing a hormone, so your natural production of it is going to kind of come to a halt to some degree.
Mm.
So it's not something that I take lightly. So when somebody wants to start testosterone, we have a real conversation about this being lifelong treatment. The same way if you need thyroid replacement, just got to take my thyroid pill every day, got to do my thing, got to replace what I'm missing. This is that too. So my personal ideal ranges for testosterone when I'm replacing somebody, if they are symptomatic and on the lower end, my goal, as long as they are tolerating it well, is to get their testosterone level between 700 to 1100. That is like optimal
Hmm.
functioning. And as long as they're not having any sort of crazy side effects from it, again, I'm not just cranking it into people trying to just like, ramp up these levels.
Like an anabolic.
Yeah,
Yeah, yeah.
we're not using it in that way. We're titrating your dose based on your symptoms and your levels and your side effects.
If someone is like, let's say a moderate case, like they're in the
Yep.
500s and symptoms are minimal, but again, like you
Yep.
said, you have to have at least one
Yeah.
symptom. Is that still in the range? Because you
Absolutely.
said you cranked them to 711, but I've always thought of like 400 or 500 as probably enough at the low end. But
So we
yeah.
have I would say probably not just this country, but in the world right now, there is I'm going to call it a pandemic of low
Uh,
testosterone and hormonal imbalances. Our world is just saturated with endocrine disruptors. Between all of the chemicals and plastics and toxins that we are exposed to across our entire lifespan. Being the age that I am, I grew up in the plastic world. Everything that we touched as kids was plastic and artificial. Everything was just
mhm.
plastic. I can only imagine how much plastic is sitting in our bodies now, and it's been there since we were, infants. So all of these things disrupt our hormones. And so there are far more men, almost of all ages now, that have lower testosterone levels than what they should have, based historically. And a lot of things can play into it. The endocrine disruptors, chronic stress, sometimes even people that work out a lot, you can literally train your testosterone. So there's a lot of different things that can play into it. But post-traumatic stress, a lot of military vets come back from overseas and they will have chronically low testosterone and feel symptomatic from it, all because of that PTSD and the trauma that they sustained over there. So there's a lot of different scenarios that cause that. So if somebody is, let's say, 35 years old and otherwise healthy, works out, takes care of themselves, no real reason why they should have low T, their T should be higher than 500. And
Mhm.
especially if they are feeling symptomatic at all. And when you go through my questionnaire of symptoms, people are oftentimes alarmed of being like, I didn't even think that that could be a part of it. A lot of people think, oh my, I'm just depressed, and they reach for their SSRI, take the Prozac, take the Paxil. And it's
Hmm.
not a primary depression issue, it's a low testosterone issue. So I do think that people with mental health issues do need to have some endocrine and hormone testing done before just immediately reaching to some of these other drugs as well, because it could be
Yeah.
very easily fixed primarily from that reason there.
I'm with you. I'm with you there. Yeah. For folks listening, for the men listening, definitely just get it tested at the very least. Have a number there, have a
It's
baseline,
so easy to get done.
and go from there. Now, women. Okay, so now we open up the Pandora's
Mhm.
box of all the potential, DHEA,
Oh,
testosterone,
oh,
progesterone,
yes.
estrogen, thyroid, and I have clients that are a lot of my clients are perimenopause, postmenopause,
Hmm.
and either on treatment or need it,
Yep.
or in some cases they, the dosage has been able to brought down once lifestyle interventions come into play, which is
Yes.
a great thing.
Yes.
But inevitably, with age, humans weren't, like you said, they weren't designed necessarily to live this long, but also the endocrine disruptors. So what does the profile for a woman look like to somewhat simplify it so it doesn't get too
Oh my goodness.
complicated?
There's really, unfortunately, no real simple way to
Okay.
simplify women's hormones. It
What
really
about the steps? Like what's step one, two,
so
three for a
step
woman?
one is
Yeah.
going to be let's get your testing done. So we're going to draw some blood.
Mhm.
We're going to get a saliva sample. We're going to send it off to the lab. We're going to see where you stand. Ideally, you're going to come in and you're going to be able to tell me that like this is where I'm at. This is my day cycle. This is where I'm at in my menstrual cycle. So we can kind of pair things in. Or nope, I haven't had a period for a year, so now I'm technically postmenopausal. So we need to know some of that. We need to know your medical background. So we need to know your medical history, what medications you take, all of it. It's all super important because this is all prescription medication. Now, from there, I will say that most women are going to, if they find that they do have a deficiency in something, a lot of it is estrogen creams these days. They're doing bioidentical creams. Most women will have vaginal symptoms. They will have vaginal dryness, pain, decreased sensation, decreased lubrication, just everything. And so now they don't want to have sex either. And that's now going to put a huge stress on things in their own life and with their partners. So estrogen creams can be very commonly used there to help improve vaginal health. Testosterone is oftentimes low too. And sometimes that is also a cause of decreased libido, poor mood, depression, kind of overall crankiness almost. And testosterone for women can be done with creams, with pellets. Pellets is a super common way to treat. And that is I like to call it a set it and forget it procedure. So with that, there's really little to no titration with it. And pellets are literally tiny, tiny, tiny little pellets, little pearls of medication. And what you do is it's an in-office procedure. We bring you in, we inject a little bit of lidocaine for numbing in the upper part of your butt, in your butt cheek, pick a side. And then from there, we take a little tiny scalpel blade, we poke a little hole. From there, a sterile trocar gets introduced into that. You don't feel anything but pressure at this point. And then we put those pellets into it. So those pellets are now going and they're living in your tissue in the butt cheek ultimately. And then it's just closed with a little steri strip and you're going to get a steady release of that testosterone or sometimes even a blend of other hormones too. It's not just T. And that's just going to be a slow release. And a lot of women really like that because they don't have to do any maintenance with it. They'll come in, once every 6 months to a year for a little top off. But again, before you do any dosage changes with any of these medications, you're always doing blood work and saliva testing to see where people's levels are at.
Right. That actually simplified it pretty nicely. What about DHEA? Isn't that a precursor to testosterone? Was there any benefit in trying to
that is a
boost
precursor.
that first?
I mean, you can. It's not one that I personally reach for that often.
Okay.
Usually if people are coming to see me, they're like ready to do something a little bit more aggressive about it. But DHEA is always a potential thing that you can look at. Also sometimes looking at cortisol too. Cortisol that one's a little bit trickier to do testing on because it's not just a one-time thing and it's not a blood test. You do a blood test for cortisol, we can tell if you have a gross disorder of it. We can tell if you are non-existent, with your cortisol or if it's wildly high. But what we want to see is your daytime curve. So we need to have you do a test kind of within the first hour of waking. And then we need to see it again towards the end of the day. And there is a cortisol curve that we try to follow with that. And if your cortisol is off, it's a little bit of a thief and it can actually steal hormones from other parts of your bodies because hormones are kind of transferred. They're not just all separate molecules. They will borrow from each other and transform into each other. So if one is low, it may steal from somewhere else too. So that's why it's important to look at all of your hormones because they will steal from each other. If you have one problem somewhere, there's a chance you might have another problem too.
A cascade, yeah. What was I going to ask? I did have a question about adaptogens and nootropics. Why don't we start there? I mean, what are your thoughts on those, like ashwagandha or holy basil, etc.?
So I can kind of take them or leave them. I don't think there's any problem with them. Ashwagandha, I find, is really just kind of good for mood. So if you feel like your mood is just a little bit meh, then it's good to do. I'm not going to say you're not going to hurt yourself with adaptogens and herbs because medications come from adaptogens, herbs, and plants. But I mean, if it's something that you want to play with and try out to see how you like it first, by all means, you absolutely can. Even with testosterone, some men, they're just like, okay, I got my testing done. I know where I'm at. I'm not ready yet to take the jump into actual testosterone replacement. What else can I do? So those are the cases where first and foremost, you got to sleep. If you're not sleeping, your testosterone is going to be in the toilet. So really dialing in lifestyle. So you need to work out, but not overdo things. You need to eat right. You need to hit all those lifestyle markers first. And then you can look at some supplementation. There's like Tongkat Ali. There's a couple of different supplements out there that are kind of pro-hormones or precursors to some of these things. And it's all anecdotal. Some people find that they work really well. Other people are like, it didn't do a darn thing. So
it's true. Okay. Yeah. I was just curious. Yeah. And real quick, the Dutch test, what do you think about that?
Honestly, I don't use it mainly just because it's wildly expensive.
Okay. Got it.
Yeah.
So you talked about lifestyle. This is a good segue into talking about medical weight
Yep.
loss. Super hot topic
Oh,
right
yes.
now.
Yep.
Controversial. They just FDA approved yet another one, the Mounjaro, I think,
Yeah, they gave the
for weight
Mounjaro. Yep,
loss.
exactly.
Yeah,
So they're now saying you can use it just for weight loss, and they're going to slap another
like on
fancy
label.
new
Yeah.
name on it and make more money off of that.
Yeah, so we have Ozempic, we have that,
Yep.
we have a whole bunch. GLP-1 agonists, semaglutide. There's a lot of strong opinions all over the place, and my opinion is still forming because it really depends, right? In
And these are
context,
peptides as well.
and they're peptides as well. Okay, because they signal that hormone, right? We're
Absolutely.
talking about the appetite
Yep.
hormone, or the suppresses your appetite as a
GLP-1s
result.
are glucagon-like
Yeah,
peptide. So they are
yeah,
all
exactly.
peptide
Fair
based.
point.
Yep.
Fair point. So where does this fit into a holistic approach then? Let's talk about that.
So I personally have a lot of feelings about them. Do I offer them? Technically, yes. Do I have some patients on them that I am helping lose weight and monitor and doing their thing? Yes. Do I tell more people no than I tell people yes? Also, yes. I think that these drugs in general are being, I don't want to say abused, but overused. They're being used by people as a quick fix or a crutch.
Quick fix.
I think that there's a lot of providers out there, especially in the med spa and wellness fronts, that are using them as a money grab. And I don't agree with that. Anybody that walks in that says, I want to lose 10 pounds, as long as there's nothing wrong with their health history, are getting put on these compounded versions of, semaglutide or tirzepatide. And they're not with a...
Yeah, I've even seen bodybuilders using them.
Yeah.
Like it's crazy. Like just to get that last shredded,
And so from a business standpoint, this is my warning to all of these, businesses that are like building themselves on these medical weight loss, just cranking out, buying vials and vials of semaglutide and tirzepatide from these compounding pharmacies, because right now you can get them from there. You don't have to get brand name Ozempic or Wegovy or Mounjaro. The only reason that you can obtain these medications right now from a compounding pharmacy is because they are on the FDA shortlist. So they are on shortage. Because they are on shortage, these compounding pharmacies are legally able to compound them and offer them. So that's why they're able to be bought a lot more affordably from clinics like myself. I do get it from compounding pharmacies, ones that I actually think are good quality, because you can buy semaglutide almost anywhere, and that's terrifying because this is an endocrine medication. So once the FDA takes these medications off of the shortage list, now, poof, you are no longer going to be able to obtain them from compounding pharmacies. And if you want to utilize them for a patient, you are going to be sending a prescription to the local CVS or Walgreens, and the patient's going to go there and pick it up. Does their insurance cover it? Unlikely. So they're going to be paying out of pocket, and they're going to pay out of pocket more than what they're paying your clinic right now for it. So the run of these things is going to be short-lived. And because of that, I don't base my business off of a medication that is on a temporary list of availability.
Yeah, no, fair enough. Yeah, and I know I would really like to do a podcast episode on this, because the more I hear about it, there are aspects of this we have to be careful of, like the ability to maintain your results long term. Yes. What it does for some level of dependency when if you're not quite fixing your lifestyle, or even when you do, what happens when you come off of it or can't get it.
Absolutely.
And so
you have to titrate onto it, so you're not just popping in and cranking in a 2.4 milligram dose of semaglutide on day one. You are going to be hospitalized and ill if you do that. So it's a titrate up, and it should be a titrate down. Once somebody has lost the weight that they are looking to lose, they are now in a healthy BMI. They're in a healthy body fat percentage. They've achieved their goal. Now, what we do is we start to slowly back them down off of that dose. And I do it slowly so that we can see how they feel, because odds are they're going to gain some weight back. On average, people gain about 25% of the weight lost back. So if you've only lost 10 pounds, let's look at that, So this isn't for the person looking to lose 10 pounds. This is for big weight loss. This is for meaningful weight loss. This is for people with metabolic risk factors that maybe have high cholesterol, are pre-diabetic, are diabetic, have all of these risk factors. This is kind of like who I'm saving this medication for. I have somebody on tirzepatide right now. Does he need to lose a little weight? Yeah, he does need to lose weight. His triglycerides were through the roof. His cholesterol was awful, and he was already taking prescribed cholesterol medication. Tirzepatide works on two different pathways. It's the GLP-1 and it's a GIP. So what that's going to do is it's also going to help with adipolysis, and it's going to help break down some of those fatty acids. So I put him on that primarily for his metabolic health and not just to shed weight to aesthetically look better. It was truly to get these metabolic markers down. So there's a time and a place for them. They have to be used judiciously. They have to be titrated down. I think that it can be used as a lifestyle modification tool because it is decreasing your gastric emptying when you eat a meal. Now that meal is going to sit in your gut for at least 7 hours before it transits through. You're not going to be able to eat as much. You're not going to be able to eat trash food. If you eat a high fatty meal or a ton of sugar, something that's really truly not good for you, you're going to pay for it. You're going to feel terrible. You're going to get that negative feedback. So in that sense, for people that don't necessarily have a great relationship with food and overeat or make really poor choices and aren't doing the right things, it can be a good tool to help get them through that and to help break some of those habits while they're losing weight. Kind of just help reinforce some of those habits, teach them how to eat correctly, teach them how to eat smaller portions. All of that can be really beneficial. But it also has to come with that warning that you're likely going to gain some weight back. Some people, especially if they have all of those metabolic risk factors already, they may need to stay on it long term. This very well needs to be a lifelong medication. When used for diabetics, type 2 diabetics, it's not a short fix for them. They're not using it for 6 months and coming off. It's a long-term medication. So, have some people had life-changing results with weight loss, and now they don't have to worry about those risk factors of type 2 diabetes. They've come off of cholesterol medication. They're off of blood pressure meds. Everything else in their life got good because of this medication. Yes, there are tons of stories of that, and it's great for that. But my problem is more so with the providers that are prescribing it really irresponsibly.
The bad apples out there. Yeah. It's a complex
money grab, and it's not without risk. These medications all have risks. The big one here is pancreatitis, and pancreatitis can kill you. So you have to really, weigh your risk factors out here. Looking at the thyroid cancer, that was only in mouse studies. That wasn't shown in human studies at all. I'm way more concerned about somebody's risk of pancreatitis than I am about thyroid cancer when it comes to these meds.
It's a complicated topic because I know even the marketing says, you'll on average lose X amount of weight in combination with a lifestyle, positive lifestyle. And of course, what immediately comes to mind, whether I'm being judgmental or not, is why don't we try the healthy lifestyle on its own and see if we can make the change. And I understand that some people are, have an excessive unhealthy amount of weight that they need to deal with right now. And there's a lot of emotional and environmental factors involved. So, all right, let's move on. Okay, go ahead.
This is one important thing that I think a lot of people don't also know. You are seeing the scale go down. Unless you're doing in-body scans or some sort of body composition scanner, you're not seeing what I'm seeing. And what I'm seeing is that most of the weight loss is coming from muscle breakdown. It's
muscle,
not
lean tissue,
coming from fat. So we are taking you and we are turning you into skinny fat. I've actually seen people gain body fat percentage and decrease their muscle mass. So they're like, I'm losing weight. At what cost?
That is a great point.
At what
cost?
Is a great point. And so a lot of my older women will come to see me and they want to lose weight, but they're like, but I need healthy muscle mass because I'm starting to get to that age where I need to worry about osteoporosis and falling and breaking a hip. I'm not putting them on that. That's not appropriate for them. We're going to go more the route of peptides. Let's help you with your lean muscle mass. So that's something to take into consideration with these GLP-1 medications is you need to be really, really careful about muscle wasting because you're not taking in enough calories to support your muscle and you're just breaking that down.
It's true, because we know even when you exceed something like 1% of your body weight a week, you're going to start losing muscle mass.
Yep.
This is an extreme crash diet version of that. Just like any other, even if you did a normal crash diet, you would see a similar result.
Yes.
And I wonder if this medication even accelerates it further, right?
Yep.
So yeah, for sure. I know we only have a few minutes left. Do you have a hard stop, or can we go a little past?
I'm good until about 3:20 or so.
Okay. Just a couple more questions, because I wanted to tie it back to the very beginning with how you got into this field of aesthetic treatments.
Yes.
And the psychological impact of that. I guess what I'm curious about is, how do you work with clients to make sure it's appropriate for them, and that there are not, negative aspects of body image and history there. And I know you've talked about this before, so I want to understand the nuances there.
Absolutely. So body dysmorphia is real, and it's a huge thing. I actually had a conversation about this exact thing with a patient of mine, I think it was last week. And the way that I look at body dysmorphia, it's not you have it or you don't. It is a spectrum. And I think that we all fall onto that spectrum of body dysmorphia. We all see ourselves a little bit different than how other people do. We may see something that bothers us every day that nobody else sees. When body dysmorphia becomes pathogenic or becomes a problem is when it's interfering with your daily life and it becomes an obsessive thought. It's now interfering. You are now doing things irrationally or doing things outside of your norm to deal with it. Let's say, for example, you have this, we're going to go super simple. You see a wrinkle that nobody else sees. And you see it when you squint an eye and you turn your head to 75 degrees and you're looking at it from upside down with the light just in the right angle and in this one particular mirror. I'm not kidding when I say that I hear that.
Mm-hmm.
That's
Mm-hmm.
not me being crazy saying that as an example. Those are things that people do. That is disordered thinking. And those are patients that you should not be treating and that you should be referring to mental health services because they need some help. Or you need to take them under your wing, not treat them, do other things that are just basic healthy skincare, and you need to be able to counsel them and talk about it and have a real conversation about it. This is a medical problem. It's nothing to dance around. You're not going to offend somebody. Maybe you will, but you know what? It's for their benefit. It's a medical condition.
Sure.
It is diagnosable. It has an ICD-9-10 code for it. Like, it's something that needs to be addressed. It's like seeing a medical problem with a patient and just not addressing it because it's uncomfortable to talk about. So you need to be aware of where everybody falls on that spectrum. With aesthetics, people are coming in because they want to feel better about themselves. They want to boost their personal image of themselves. They want their outsides to match how they feel on the inside, or they have something that they've been insecure about for a while that they want to fix. And that's okay. There's nothing wrong with that. It's like saying, I have really weak and small muscles, or, my glutes are really small. I'm going to go to the gym and I'm going to really work on building up my glutes. And I'm going to do that because I want it to look the way I want it to look. And I'm going to be healthy about it too. There's nothing disordered with that. And that is a normal, healthy thing. We all want to be our best versions of ourselves. And that also falls into aesthetic medicine. But hearing the way people talk about themselves, are the only things coming out of their mouth negative? Can they not give themselves a compliment? Something that I started implementing this year during my consultations is, before we talk about what the problems are, tell me what you like about yourself. Tell me what you love about your face. What's your favorite facial feature or your favorite body feature? You need to be kind to yourself, and you need to recognize that we're not all perfect and it's okay. So listening to her red flags, I've seen 6 providers this year and nobody's been able to make me happy, but I know you're going to be able to make me happy. I'm not touching you with a 10-foot pole. That is such a huge red flag. It's unbelievable. So it's really just having conversations. And that's why you need to talk to your patients. You need to really get to know them. You need to understand the driving force behind why they're asking for these things, why they want to have procedures or interventions done. And you need to, be educated about body dysmorphia to know, is this appropriate? if I start treating this person, am I actually adding fuel to the fire? If some people you don't know, some people definitely have duped. Every provider that does what I do has been duped, where somebody,
Mhm.
keeps it together until you start treating. And now all of a sudden they're becoming angry. They're becoming combative. They're pointing fingers, blaming you that you didn't give them what they want, but you did. And they will never
Mm.
see it for what it is. They can't see it for themselves. They think they are just ugly and are never fixed. So mental health is huge. It's absolutely huge. And if you're not addressing it in, your aesthetic practice, you are doing such a disservice to your patients.
Yeah, I like how you ask your patients what they like about themselves, right? Because kind of leaning into their strengths and making
Yep.
sure it's a filter for that, and then also understanding why someone wants to do something. I think I just came out with a mini episode called "It's Okay to Want to Look Better and Improve Your Physique," and it was
Yep.
around that whole theme of
Yep.
like there are many reasons we do things. I don't envy how much more difficult it might be in your type of practice, like nutrition coaching. It's a little bit easier, but even there, you see people who the red flag is they just want to lose weight at all costs, for example, right? And there's a red flag there. Are there any misconceptions people have? I'm sure there are, but like, what are some of the big misconceptions people have about medical aesthetics, and how do you work to educate them on those?
Sure. So, I mean, a lot of misconceptions, come from people that just genuinely have no idea what we do. And all they do is they see examples of celebrities with bad plastic surgery and they just think it's Botox. you know,
The lips. It's always the lips.
Botox is always just the go-to. Oh, it's bad
Yeah.
Botox. And are there people out there with bad work? Yeah, there absolutely are. Unfortunately, there's very little regulation when it comes to aesthetic medicine. If you have a medical license, you can do it. There is no governing body for anybody other than dermatologists and plastic surgeons. And even then, there's little standards with it. So there are plenty of places out there that will give you botched work and give our industry a bad name, and they don't have ethics and they're just going for money grab. Somebody comes in and says, "Make it bigger. I want my lips bigger." And now they're, out to here and just look distorted. There's always going to be somebody out there that will do the thing that you ask them to do, and it's unfortunate.
Mm.
But I mean, that's just about
Sure.
in every industry.
Yeah.
And ultimately I look at it as skincare. It's your skin, it's your biggest organ, and we're taking care of it. When I speak to patients about, the reality of aesthetic medicine, doing in-office interventions with lasers or injectables is hands down the least important thing that we're going to be focusing on. First and foremost, we're looking at your lifestyle, we're looking at your sun exposure, we're looking at your skincare products. Not using good quality skincare products to take care of your skin on a daily basis, but coming in for, one or two lasers a year or your Botox is like going to your dentist for a cleaning and then not brushing your teeth at all at home. It's that same thing. We're taking care of skin. And when you have healthy skin, you have beautiful skin. You don't need to be augmented and have cosmetic interventions. It can be more restorative. And I like to look at it in those two realms here. Restorative medicine, we're restoring you back to way things should be. You have volume loss from fat atrophy in your cheeks. We're replacing it. We're not augmenting you and making you look deranged. We're just restoring it. It's like restorative dentistry. They're not giving you, crazy looking teeth. They're restoring it back to a natural looking form. Whereas more cosmetic medicine, we're taking somebody that there's nothing wrong with them. They're young, their volume is perfect, and they want something a little bit more dramatic, a little bit more augmented for just an aesthetic cosmetic outcome. So those are the kind of two ways that I look at it. But the best injectables truly should be undetectable. Nobody walking down the street that doesn't know you should be able to point out what you've had done.
Okay, and there are gender differences for a fact, and I am clueless about all this stuff. I don't use any creams, I don't use product, and I'm probably like 95% of men, I'm guessing. What's some interesting differences? And I'm sure you work with men,
Yes.
but like, I don't know, what are your thoughts on the matter?
So first off, it's easier to get a man in the door to do Botox than it is to get them to put any sort of cream on their face at home. Hands down.
Okay.
Hands down.
That's funny.
Stop washing your face with shampoo. I'm speaking to all of you. Stop doing it. So, I mean, basically, if there's one thing that you're going to put on your skin, and I tell this to all of my women who are trying to get their men to start taking better care of their skin, is you need to wear sunscreen. I mean, you just do. You need to wear sunscreen. That is the most important thing that you can do to help prevent poor aging and help improve skin health and also fight skin cancer. So the basics of wear sunscreen, you don't need this crazy 12-step skincare regimen to take good care of your skin. If we're giving you daily antioxidant protection, taking all those free radicals that you're exposed to, from blue light, from pollution, from the sun, from intrinsic factors inside of your body, all of it. You need to be fighting those with antioxidants. Vitamin C is a really good one to utilize with that. We can even use topical peptides to help with that too, helping support collagen. Collagen is what gives us our nice firm skin. It's what makes it elastic. That's why kids' skin is so bouncy and tight and looks good. And as we get older, we get kind of saggy and thin and wrinkled. That's from loss of collagen and elastin. So if we're using some peptides or growth factors to help stimulate that, help keep your skin look youthful, wear sunscreen to protect you from the sun, I mean, we're done there. And a lot of these skincare companies have really gotten smarter when it comes to men's skincare, knowing that we'll be lucky if we can get you to put one thing on. They have made combination products to where you can grab one bottle and it is your skin treatment, it is your skin antioxidants, and it is your 8-hour-long sunscreen. My favorite one that's come out comes from a company called Peptides. It was developed by what was she? She's a chemical engineer, either Harvard or MIT. I'm screwing that up. And basically, it's a sunscreen, mineral-based sunscreen that you put on your skin once a day. Stays on for 8 hours, so you don't have to reapply. And it also contains anti-aging elements and antioxidants to help take care of your skin. So I'm really pushing that for men to make it easy. It's not going to make you shiny. It's not going to make you look glittery and shimmery. It's going to make you look good. It's going to make your skin look healthy. And really at the end of the day, for me, it all comes down to skin health. We want your skin to be healthy like the rest of you.
I mean, even just the sunscreen alone is definitely important if you're concerned about skin cancer and things like that. But these are some great tips that I didn't think we'd get to talking about, skincare advice for men, but it's awesome. So I'm going to look up that Peptides myself. Yeah. I take high dose vitamin C, but not really any of the other stuff. Yes. So I just use the touch up feature in Zoom and that does it. All right. So I like to ask this of all guests, Kristin, and that is, what question did you wish I had asked? And what is your answer?
Oh, boy. What did I wish you asked? That's a good one. I think you've asked really great questions. I think that we've really covered everything well. I don't have anything else burning inside of me that I didn't get to get out here. I guess really my main takeaway point for listeners, especially in the wellness front, is get your blood drawn. Don't stop being scared of what your blood work's going to show. And get it done. The best thing that you can have is knowledge and to know where you're at. And if you get blood work done, bare bones minimum once a year, if you can get it done every 6 months, you are so ahead of the curve and we can really identify early issues with you. Just recently I had a patient come in. She was interested in starting peptide therapy. And we pulled her blood work. I'm looking at things that your primary care is not. I'm looking at fasting insulin. I'm looking at C-peptide. Those levels on her were triple what they should have been. So we may have identified an insulinoma in her, which is a tumor that secretes insulin. And if she had just gone to her primary care for her basic yearly screenings, they would have looked at her A1C, which was totally fine, and been like, you're good to go. Your metabolic health looks great. While lying underneath is a potential huge problem. So we look at things that your primary care will not and does not, because insurance is either not going to cover it or they just don't have the time to look at it.
There you go. So if you're listening, get the blood work, and ladies, get the saliva test if that's indicated. Talk to Kristin. I'm going to ask her now where people can reach you, but reach out to her. Even if you're not in Connecticut, I'm sure she can help you even with a discussion online. And actually, why don't you let us know where people can find you? And then for people who are remote versus people local to the Avon area. So you can find me first and foremost at Ethos Medical Aesthetics in Avon, Connecticut. We're located at 51 East Main Street. From here, ethosmedicalaesthetics.com. From there, you can look at my full list of services, and there's even a book online function. So if you want to book a consultation or any services, you can do it right from there. On Instagram, most you're going to find me is at Injector Kristin.
Kristin, Scandinavian IN on that one. So you'll find me on there. Everything is also over at Ethos Aesthetics. That's the best way to find me, is truly on Instagram or make an appointment. I do have some virtual options as well. However, if you are interested in testosterone replacement or hormone replacement therapy, those are controlled substances. I need to physically see you in the office once. You need to come in and sit in my chair and face me and have a conversation so that we can do our examination one time. And after that, if you're a candidate for treatment, we can do everything virtual. We can do virtual follow-ups. All of that medications can be sent right to your door. Depending on states, I don't have it right off the top of my head. Some states I cannot practice telemedicine in, and you can't have certain things shipped to. But for the most part, we cover most of the country. So peptide therapy, ordering blood work, all of that we can do remotely. So there's a lot that we can do there.
That is great to know, actually, that distinction. You can find Kristin at Ethos and Avon. I'm going to include all that information in the show notes. ethosmedicalaesthetics.com, at Injector Kristin, at Ethos Aesthetics. I know it's a lot. I'll have it in the show notes. And then also the podcast, which is going to start up again for another season.
Yes.
And so Just a Pinch podcast. So go follow that. And it was one more thing I was going to say, and I can't remember what it was, but it's been awesome I know what it was. For folks listening, I definitely vouch for Kristin. I mean, I met her through another man of very high standards and ethics, and Andrew, and that's how we find people we trust. And again, Kristin mentioned this industry is rife with charlatans. And so you've got to be careful and find good people. And Kristin is one of them. So Kristin, thank you so much.
Andrew is an open book and is more than happy to talk to anybody about his experience with both testosterone and peptide therapy, everything that we've been doing. I mean, if you go onto the Instagram, you'll see he's written out like how it changed his body composition, his blood work, all of that. So if you have any questions, you can also seek him out. He'd be more than happy to give anybody a personal testimonial for how his experience has been.
Awesome. And I'm declaring right now that I'm going to set something up with you and talk to you about it. And then hopefully I'll be able to talk about it on the show, depending on what happens from there.
Absolutely. Knowledge is power. You just got to know where you stand.
Yeah. All right. Thanks so much for coming on.
Thanks so much.